there, Dr. Andrea Schnowske from Freedom Chiropractic and Holistic Health in the Peoria Metro Center and our YouTube channel, Health and Horsepower. This week, I want to talk to you more about why trampoline parks and diving boards can be so dangerous for your spine, and especially children's spines that are still developing. So when it comes down to it, when we are jumping on trampolines and diving boards and doing a lot of repetitive compression motions, we are taking our body weight and we are actually putting, because we have motion behind it, we have gravity and momentum, compressing the spaces between our joints. So you have the vertebrae in your body actually have a cartilage disc in between that when you're doing a lot of pressure and compression, you're squeezing the nutrition and the hydration out of that disc, which can lead to that disc breaking down. Or sometimes if you're a bit older, if you've had damage before, that can actually cause disc bulges and herniations as well. And what tends to happen is when we do a lot of repetitive bouncing motions, not only are we putting wear and tear on the cartilage, but for children's spines that are still developing, because let's face it, when it comes to the lumbar spine and even the pelvis, those bones don't fully solidify until we're in our early 20s. What can happen is you can actually have that repetitive motion causing damage, leading to cartilage wear and tear, leading to facet or bone damage, and even leading to premature arthritis. So if you have a trampoline, if you take your kids to the trampoline park, what I would recommend is that we do a lot of stretching before the trampoline park. We want to make sure we're doing ice after the trampoline park and stretching out the lower back, spine, pelvis, hips, and legs really, really, really well. But I would also make sure that you're limiting that to no more than once a month, because if you're doing a lot of compression on the lower spine, and especially in children that are developing, that can cause issues if we do it more often than that. So I am not a big proponent of trampolines, but if your kids do go to a trampoline park and they do fall, or say somebody bounces them and they end up falling or compressing and get hurt, you want to make sure you get their spines checked. So again, most important to make sure is we do ice. That'll help to calm down any acute injuries. It'll help to relax muscles. It'll help to reduce disc swelling and any pain that they're having and numb the area. I would also recommend doing stretching right afterwards. If there's pain while stretching, you may need to take them to get an x-ray. You may need to take them in to get evaluated to see if they've hurt or injured their spine. I have had children that have been to trampoline parks and actually injured their neck and had torticollis where their head was tipped to the side. I've had kiddos that have injured their lower backs. I've had them injure hips and knees and ankles as well. So I typically in my office do more of a conservative approach. I do an evaluation to find out, is there a joint alignment issue? Did we sprain any ligaments? Do we actually pull any muscles? And then I make sure that not only do we realign the joints, make sure that those muscles are loose or relaxed before they leave the office, but I give homework instructions to make sure that we know how to take care of them at home to prevent injury or further issues later on down the line. So if your kiddos are doing diving boards or trampoline parks, if they've been injured, make sure you're taking the proper precautions before and after. If they have an injury, make sure that you are doing as much as you can at home to get it calmed down. If they're still complaining of pain, you might need to get an x-ray or get it checked out by a professional. So hopefully that helps. If you guys have any questions, feel free to give my office a call, 309-689-6200, or check out our website, freedompeoria.org.